Thank you, Tim, and thank you, Peter. It is a pleasure to be here at Men, Cancer and HPV webinar. It is an honor indeed. My name is Samuel Ziwada, original from Zimbabwe, but I'm here living in Cape Town, South Africa for almost 20 years plus. And I've been working with organizations such as Cancer, people living with cancer, and now as an independent cancer advocate, cervical cancer advocate with Cancer Alliance of South Africa. But before I delve deeper into that, let me take you to my personal experience with HPV or cancer caused by HPV. My wife was pregnant with our second baby. It was 3 months of pregnancy, and we started to see the discharges. We knew something was wrong, but we didn't know what exactly was wrong. And all the endeavors to find out from the local clinics, it did not yield any result. Up until we decided to go to the private GP, that is when the doctor see that there was something wrong after performing ultrasound, the scan, and doing the papilloma virus testing. And so he recommended that we go to the bigger hospital together with the scan, and he made a telephonical appointment for us at the bigger hospital to the gynecologist, which is the maternity ward at that hospital. And so on the day of the appointment, we got to the hospital early morning. We met with the doctor, and she looked at the referral letter, and then before she looked at the results from the referral doctor, she then asked for our IDs, and we handed over our refugee papers, because both of my wife and I, we were refugees here in Cape Town, just as I am still. And upon that, she dismissed us and say we must go back to the local clinic immediately. And so we just see the change of demeanor, the language changes to everything. But needless to say much, we went back to the local clinic. Still, nothing was taken care of up until the end of the pregnancy semester. It was 2 weeks prior to the into the 9 months, and so then the gynecologist discovered that something was horribly wrong, because the baby was pushing to come, but there was no way it could come, because there was no more the amniotic fluid surrounding the baby. And so immediately they called the ambulance to go to a bigger maternity hospital, and arriving there, they go straight to the theater. And it was during that delivery process where the doctor discovered that there was a growth on the cervix. And so after the delivery, it was taken to the bigger hospital for further assessment, and it was discovered that all along she had developed cervical cancer. And 3 months into the diagnosis and the first 3 treatments of radiotherapy, she lost the battle, and she died on the 13th of December 2011. And so it was after that I started to dig deeper, because prior to that I did not know anything about cancer. I just heard. And so even during the diagnosis process with the whole bench full of doctors. I did not know. I did not have any question to ask because I didn't know nothing about cancer or HPV for that matter. And so, but there were some lessons throughout this process that I think even today they still need to be addressed. Because you see, the basic treatment for cancer is time. And so there is a need for doctors and health practitioners to be well aware of what HPV is all about, and it needs to be advocated for and taught in the local clinic, and it also need to be treated just as they do with HIV, tuberculosis, and blood pressure, you see, and diabetes. Because I see that in most cases at our local health clinics or in hospitals for that matter, there is a tendency of hesitating to go straight into HPV or any type of cancer straight. I don't know if it is a stigma or is a lack of knowledge, but it really needs to be addressed. And the second thing that comes out of this experience is that there is a wider need of education to our population, particularly in the rural areas and where there is no internet, where there is no reach out physically also. I admire what they are doing in Kenya. For example, they have what they call mizizi, which is a Swahili word for the roots, where they physically go like they take the advocacy straight deep into the rural areas where people they have no knowledge of anything to do with cancer. And the other lesson is that men they need to be more involved in this, because even if it does not affect a man directly, it still affects a man in another way. For example, in my case, if I did not get involved up to this point, I wouldn't be able to speak about it, and also I wouldn't be able to be supportive. And so in most cases, women, once they are diagnosed with such cancer as cervical, most men they just abandon them and they move on to another woman, or they just refuse to support in terms of the children, or in terms of transport money, etc. They just abandon the family and move on. So again, it is a lack of knowledge, and as long as men knows about it and have more knowledge, they will be more involved and more supportive, and that is what we need to aim. If this stigma have to go away, if we need men to be standing their ground and support this whole process. And so in conclusion, I think the best way to beat this HPV caused cancers, it all needs education, it needs advocacy, it also needs more involvement in terms of men, whether it's vaccination for boys and girls, whether it is for men being there whenever women are diagnosed, or acquiring knowledge for themselves. That way we can be able to beat it. I thank you.